Hi, I'm Dr. Demesmin from University Pain Medicine Center. I'm the medical director of the University Pain Medicine Center. I'm also the director of pain management services at St. Peter's University Hospital. I'm also program director of the Pain Fellowship at the JFK Interventional Pain Medicine Program in Edison, New Jersey. And I'm also an advisory board of Bella NYC magazine. So today I'm here with Mrs. Prickard, who presents with back pain and neck pain after being involved in a motor vehicle accident. Mrs. Prickard here presents with neck pain going down the arm, which may be indicative that she has a disc herniation present where the disc is pressing on the nerve. In addition to that, she also presents with what we call cervicogenic headaches. A lot of times patients getting involved in motor vehicle trauma will present with what we call flexion and extension injuries, where the cervical facet joints of the neck goes through a traumatic injury where the patient will present not only with neck pain but with headaches as well. We pride ourselves as a practice to perform a thorough history, because the history tells you a lot of the mechanism of what may be going on with the patient's pain pathology. In addition to performing the history, we do a thorough physical examination and we review a lot of different imaging studies that the patient may have in order to come up with the diagnosis. Importantly, it's very important for you to notice that we also work with the patient's physical therapists, the chiropractors, their internist, their orthopedic surgeon, because we believe by working in a collaborative way, we can ensure the patients the best treatment options, because if we know that the patient's had chiropractic care in the past and failed to get any relief, if the patient has any medical condition that can preclude her from going into any of the minimally invasive procedures that we need to perform, and that's the importance of working as a team with their primary care physician and the orthopedic surgeon to make sure that the goal is to get the patient back on her feet and back to work so she can be pain-free to carry on with her life. Okay, so patients with motor vehicle traumas or any kind of traumatic injuries, it's important to perform a physical examination. And the purpose of the physical examination is to observe for motor abnormalities, meaning that if there's any signs of weakness, of nerve damage, or we have to look also if there's any problem going on with the cervical, which is the neck, the mid-back, etc., to see what else may be going on in the patient. So by looking at Mrs. Prickard here, we do what we call a palpation examination, where we look for any types of abnormal contour of the muscle. For example, there's spasms present, which indicates that there's muscle injury present there. In addition to that, we do a range of motion examination, where we look at the patient range of motion to make sure that it's not restricted if there's any pain with the range of motion. The one thing that we do also, in addition, we also palpate the lumbar spine as well to look for spasms, etc. Range of motion at the lumbar spine is also very important, where we're going to ask the patient to flex forward as much as they can to see, one, if there's pain reproduction, and also if there's any limitation to the physical examination. In addition to flexing, we ask the patient to extend their back as well. And by doing that, we also notice for limitation in the range of motion, and also if there's any pain when she's extending her back, which may be indicative of joint abnormalities to an extent. Okay, I'm going to have you sit down. And other part of the examination also involve, very importantly, the neurological examination, which involves testing for strength by asking the patient to lift the leg up as much as you can. Let me ask you to, okay, just move against resistance. You can move it up again. Very good. And we can ask the patient to lift the leg in this direction. And again, it's by observing the strength present. Neurological examination also involves checking the reflexes, where we check the knee reflex and we check the ankle reflex as well. Another test that I tend to that I perform on a patient is to ask them, let me have you stand up. I ask the patient to stand on can you stand on your Okay, very good. And can you stand on your heels and walk? Okay, very good. So all these are simple tests that can be done to test the integrity of the nervous system. For example, if there's any motor abnormalities, weakness, the patient would have difficulty standing on her toes or walking on her heels. Okay, so again, Dr. Demesmin, University Pain Medicine Center. If you have any additional questions regarding the type of treatment options that we offer for patients with any type of traumatic injuries, including motor vehicle accident, feel free to contact our office. The website will be provided along with the telephone number. Thank you very much, Mrs. Picard.
Thank you.
Appreciate it.